Hi everybody, this is Dennis Stanley. I want to take a moment to review with you how to review and to investigate and study a clinical simulation a little bit deeper. Now what you see on the screen here is that from your LindseyJones dashboard you can look at a previous activity, and I'll show you that in a minute, but you can look at a specific clinical simulation and you can go right back to that clinical simulation and review how it went for you. And so here's an example of that review. I'm going to show you how we got here in just a moment. But as you can see, it lays out the clinical simulation as you went through it. So it shows you, in this case, that the simulation was in teaching mode because as I picked things, not only did it give me the answer or the result of that, but it also told me whether it was correct or incorrect, and it gave me the rationale. So a lot of times when you're doing a clinical simulation and you've done it a few times in testing mode, then you want to just learn the simulation, you can come back and you can put it in teaching mode and you can just select everything, and who cares what your score is, right? And when that happens, every time you do that, every time you do a simulation, it records everything that you did inside. Now here's an Achilles heel. It does not record those things that you did not pick. So in that sense, it's not necessarily that good to review the whole simulation. I'm going to talk about that and tell you absolutely the best way we have figured out for you to maximize your understanding of simulations and really increase your scores, but I'm going to show you that it's a little bit uncomfortable. Most students or people who are studying would love to just see some manual with all the answers laid out. I'm going to show you why it's good for you to struggle. But one thing you can do is you can come in here and you can go through the case scene by scene as you went through it and read what you picked, and it'll tell you if it was right or wrong, and you can review that whole simulation right up until the end. Now let me just show you how I got here. I'm going to go back to my dashboard. If I've done the simulation recently, and this is the most recent thing I've done, it'll show up right here. And this is the second most recent thing I've done, and this is the next most recent thing I've done. Now I can hit view all activities and get there as well, but I can look, here's just a little hot quick button that I can go right now. I can go review this simulation by just hitting this, and that's how I got here. Let me come back. You can also technically go look at the result of the simulation if you want to look at the scores and see how you did. A lot of people don't really do that, but you can do that if you need to. Now, also, what if you did it 3 or 4 exercises ago? You can view all activities, and this is everything that this person's done. It's like a gigantic transcript of everything you've done, and it tells how you did and how long you took and whether you completed it or not. And it tells you your score if it's a TMC exam. If it's a clinical simulation, it just tells you whether you passed, failed, but you can look at the details by getting into here. Or you can go back and in place of review, we have history. It's the same thing. You can go back into review that and it'll show you everything that I've done on this one. This was obviously one that I started and I didn't choose a single thing and I exited. So there's not a lot of information there. As I go back to the dashboard, look at activities, the most recent thing I did was this multiple trauma. I can look at the history or review it, and it takes me back to that review section. All right, so that's how you can review a clinical simulation. Now let me just give you a little bit of advice here. The best way to learn what's going on in a clinical simulation is to do it again and again. And that's what this tool is really for. So the best way to manage a simulation is to go here, and instead of doing it in teaching mode, just do it in testing mode once, twice, 3 times, 4 times, as many times as it takes for you to get your grade higher and higher. What you're going to feel as you do that is a little bit frustrated because you're not exactly sure why you're getting the points you are, but you'll also discover as you go back through and think about it a little bit more and more and really try your hardest, generally your scores will probably go up. It's just that you're not sure exactly why. And of course, that struggle causes you to understand what's going on in the simulation. Keep in mind that we're not going to write a word-for-word simulation like the NBRC. So you could memorize these all day long. But if you don't understand why you're doing what you're doing, you'll get a false sense of security as you go through it once, twice, look at the teaching mode, look at all the answers. You'll think you understand it, but really you might have just memorized it. So it's better to struggle through it. And then when you get on the actual exam, you're going to see different stories, different cases, but you should feel comfortable because the process and the cognitive level or the the difficulty level is about the same. And so it emulates the NBRC, but it doesn't copy the NBRC. And that's really how you want to do that. So when you want to learn a clinical simulation, yeah, you can go back and review everything you've clicked. I don't know if that's super helpful. It's there for you if you need it. But the really best way is to just go back and do it in testing mode 2, 3, 4, 5 times, however many times it takes to get a passing grade. And then after you're finished with that, go ahead and begin it in teaching mode. And then you can pick even answers that you're pretty sure are wrong, but you can read the rationale, and then you can read that, of course, in your review. You can really study that on your own. But that's just a good advice on how to review a clinical simulation and how to gain all of the understanding you can out of that type of exercise.